Hi, my name is Anna and I am the owner of Little Wings Sleep, and I am a certified pediatric sleep coach. So today we're going to be talking about dream feeds. This is something that can be really popular. A lot of moms are just like, just get an extra feed in, just dream feed them at 10 p.m. before you go to sleep, and it will mean that they sleep all through the night. Like, let's stack feeds there, and it means longer stretches later. However, there are some misconceptions around dream feeds and how they should be used, and I'm not against dream feeding. I'm against using them all the time for every situation rather than using them strategically. So let's talk about dream feeding, what is helpful, and then what is strategic. So first of all, when we understand how sleep works, a baby understands I do this equals going to sleep. So rocking equals going to sleep, or nursing equals going to sleep, or I'm tired, I need to go to sleep, and I'm in the crib equals sleep. When you wake a baby up, however they wake up is their understanding of how they wake up and get back to sleep. And so, for example, if baby always wakes up, then when they're feeding, then they expect to be fed straight away, and they get pretty grumpy if they're not fed straight away. So what they end up having a wake to eat association rather than an eat to sleep association when it comes to sleep. So with dream feed, what a dream feed is actually taking a baby who is already asleep and feeding them while they're in that drowsy state. Drowsiness is the first stage of sleep, and so when they're already asleep in that drowsy state, they're feeding while they're asleep. We're activating that sucking reflex, and they're consuming milk, and so that's what a dream feed is sleep is feeding them while they're still drowsy, and we're waking them. If a baby wakes and we feed them, then that's a night feeding rather than a dream feed. So dream feed is parent initiated, and night feed is child initiated. And so we end up with this wake to eat association if we end up having dream feeds too often. What that then means is that a baby struggles to drop night wakings, night feedings, when they are actually ready to, because dropping those night feedings is not about age, it's about weight. It's more about 13 to 15 pounds. So we're not looking at, okay, yes, my baby is 6 months old, or is 4 months old, or 8 weeks. 8 weeks is a common one where people are like, they should be sleeping through the night. It's not actually about that. It's about how big is baby. And some babies need to be a little bit bigger than that 15 pounds. And so when they're used to waking all of the time to feed, then it means they're going to wake up more frequently. It means that they're going to keep those night feedings in. So when would I use a dream feed? There are 4 scenarios that I would use a dream feed in. The first one would be dehydration. Dehydration is when you've been outside a lot and you're not sure that baby's consumed enough liquids, and you're worried about dehydration, or maybe something's happened that you're going, I really need to make sure my baby is hydrated. The second one would be sickness. If your baby is sick, they do need extra fluids. So this is a really nice way to tuck in something, tuck in a feed. We can just do that before you go to bed at around 9:30, 10 p.m. The time doesn't really matter. If we're going to do it consecutively though, I'm going to flux the time so it's not staying at the same time. So sickness, we want to make sure they're really hydrated and getting extra calories. Medication, I've had some babies I work with where they needed medication at a specific, during the night, at a specific time. And so we used a dream feed because the medication had to be taken with food. And so we worked with the doctor to kind of vary those times so then it wasn't stuck in one place. Because a night feed that is always at the same spot is a habit. If it is fluxing and moving, then we know it's more hunger-based. And then the last scenario would be weight gain. Some babies are struggling to gain weight, and so a dream feed can be really helpful to add in an extra feed to get those calories in there. So traditionally, when people say dream feed, they are saying just pick the baby up, keep them as asleep as possible, and add in a feed. However, if we can slightly stir baby using a diaper change, moving them into a place with a very, very soft lamp, they're actually aware that they're feeding, they're aware that they're taking in milk, and that means that we're able to have a better feed. Also, the more alert that a baby is during a feed means that they're able to not only have a better feed, they're able to go back to bed more easily when they're using those independent sleep skills. So, for example, the other day was the hottest day in British Columbia history, 44 degrees, and my 12-month-old, we had her birthday party. We just had a couple of friends in the backyard, but it was like 38, 40 degrees outside. And we were in the pool all day. Apart from nap time, she was in the pool with me. And so I had been trying to keep fluids in her, but I wanted to make sure that she didn't get dehydrated, because we do not want a baby to get dehydrated. Oh no. And so what I did is that I got her up, changed her diaper. I kind of like didn't have a whole lot of clothes, so I left the sleep sack off, I left the pajamas off, and I gave her that full feed, put the pajamas and sleep sack back on, and back into bed. It doesn't need to be a long ordeal. It doesn't need to be a massive feed. Like, we don't need to be doing like 10 ounces if that's your baby's big bottle, or a big breastfeed or something like that. It doesn't need to be the biggest feed that you've ever done. We want to make sure we're tucking in a reasonable feed, but they're aware that they're feeding. If you need to do it multiple nights in a row, then we're going to vary that time. So say we're going from 10 o'clock to 9 o'clock to 11 o'clock to 9 o'clock to 10 o'clock. So the body's not getting into a habit of needing food then. We don't want to necessarily do it consecutive nights unless we're looking at sickness or weight gain or medication, because we want to make sure that baby is able to drop these when they're ready. If you're night dream feeding and you're going, wow, I did not know that this actually can cause more wake ups and can make sleep much harder, what is the best way to get rid of dream feeds? The best way to get rid of dream feeds is honestly just to stop them. So just stop them, let them be, and when baby wakes up naturally, now just let them wake up and do a night feed like you normally would. The reason also that we don't necessarily want to do a dream feed when, like in the late evening, is that the first stretch of sleep is the longest stretch. So when they go down for bed at 7 p.m., 7:30, that longest stretch is going to be their longest stretch, because that's the way the body clock is built. That is going to be the longest stretch. So we don't want to mess with that body clock, that circadian rhythm. We want them to have that stretch, because that's the night stretch that like lengthens out. And I know getting up at 2 a.m. sucks, but guys, this is a season and your baby will be able to drop those night feeds, and you've got it. And it will make a huge difference to your baby's sleep. Have an awesome day, and I hope that you have a great sleep. And I hope that this is a powerful tool that you can use in circumstances when your baby needs it.